Now, from the News Channel 5 network, this is Medical Mondays.
Hi, everybody. Rhori Johnson in the chair for Carrie Sharp tonight. Great to be back here on News Channel 5 Plus, and we're ready for a great Medical Mondays. We hope you're tuning in, and we hope you will call in. A great opportunity for you to call in and talk with health experts throughout the mid-state area on some important topics. And let me tell you, tonight's topic affects a lot of people. We are talking about knee replacement. You or someone you know has probably undergone this procedure maybe in the last couple of years, and if they have, then you know, or maybe you're considering it. So now's a great time to call in and get your questions answered. And we have a terrific expert with us tonight. He's an orthopedic surgeon. His name is Dr. Thomas Gautsch. Good to see you, Doc. Thanks for coming in.
Thanks so much for having me.
After, I would imagine, a busy day for you, so we appreciate you wrapping up your day with us. I assume you're wrapping up your day.
I am.
Okay. You are with Advanced Health and Southern Sports Medicine Institute. Tell me a little bit about that group that you're with.
So Southern Sports Medicine Institute is a group that I started almost 20 years ago now, and it's largely tailored to things that I do, that I sort of specialize in, which is knee and shoulder surgery, almost exclusively. Okay. And I built a practice that allows patients to have physical therapy there. We've got MRI scanning and also surgery, and we've also got an outpatient surgery center now.
So all right in one facility.
All in one.
From the beginning right through, you can take care of the patients.
That's exactly right.
Oh, that's terrific. All right, 737+, you know the number, folks. It's on the screen if you would like to call in as we discuss knee replacement. And really, it's fascinating because you mentioned outpatient. And, you know, 10, 20 years ago, 20 years ago especially, this just wasn't the case. I mean, the advancements that you've made in orthopedics to be able to make this what used to be a major surgery into something where someone can literally go home the same day. It's pretty remarkable, isn't it?
It really is remarkable, and I've been practicing really through that whole evolution.
To watch it, yeah, you've watched it advance.
And, you know, I've even tried to help advance it somewhat. In fact, I think I did the very first outpatient knee replacement surgery here in Tennessee, and have kept trying to chip away at the various things that were obstacles to that, to the point now where I've recently finished, or just about to finish, a series of my first 100 done at a surgery center that we built specifically for outpatient knee replacement at the north end of Nashville in Hendersonville.
You know, the advancements, I would imagine, you mentioned the things that you've tried to do as a surgeon and as a doctor, a healthcare provider, and helping your patients. But I would imagine also the companies out there that are doing so much R&D, research and development on the actual devices and the things, the tools that you use during surgery, right?
Yes, that's right.
Have changed and have really helped you.
That's true, they have. And in fact, they've advanced to a level now that the instruments and the devices aren't really the issue anymore. We've largely conquered the material issues. Knee replacements just don't wear out. The instruments are really, really good. I have a virtual reality workstation in my operating room that allow me to take data points from a patient's actual knee and basically put together a new surface or a new knee that's exactly custom fitted for them. The size, the shape, the alignment, everything done right there using computers in the operating room.
So the basic question right off the top then would be, what is a total knee replacement?
So that's a really good question. Yeah. Here's how a lot of patients ask me. They come and they've been told by their primary doctor, all the things that we've tried aren't working anymore, the patient's having a lot of pain, they're limited in their activities, and so they've been told you need a knee replacement, and they're sent to me. And often people will say, what are you going to do with my old knee? And my answer is, I'm going to send it home with you. And the reason is because knee replacement isn't what people imagine or what it used to be. It's not chop, take out the knee and then put in all new something. It's a resurfacing procedure. In 2017, a modern knee replacement is really just putting on new surfaces, like crowning a tooth. So you sneak in and shave the surfaces to even them up, and then put new surfaces back.
What surfaces? Does it depend on the patient and what wears out or what needs, or is it typically
It does.
A general, you know, and so, remind me of my anatomy here in the knee of what we're talking about.
Leg bone connected to the calf bone, right? So the thigh bone at the very end of it is somewhat rounded, and the calf bone is fairly flat at the top part. Right. And the knee comes together basically so that you can have a hinge going on there that'll bear your weight and be stable and everything. Those surfaces where they come together is what wears out. That's what people end up damaging or wearing, or just their genetics are such that they lose those surfaces and yet still want to be active. But that's what makes the joint painful.
Yeah.
So, so you lose those normal smooth surfaces, and what we do now is keep the bone, keep the ligaments. So, you know, test everything and keep what's good.
Right.
And the bad part is the worn out surfaces. So we put on new surfaces. Now that can be done as a partial replacement if only a portion of the knee has worn.
Right.
Or what we call total replacement isn't because everything's being replaced, it's because all the surfaces that come into contact with each other are getting renewed.
Renewed.
Yeah.
Okay. What about the knee cap?
Yep.
What is that?
So the kneecap is where your thigh muscles, the quadriceps, come and attach to the top of the kneecap.
Right.
And then the bottom of the kneecap has a tendon that goes down and attaches to the calf bone. So that when your quads pull, they pull on the kneecap, which then transmits that force down to the calf bone and allows you to straighten your leg. So that also gets its own new little surface in a total replacement. Or if that's all that's worn out, that can just be replaced as a partial replacement. But it's just the surface. The kneecap stays. Is
this inevitable in the aging process, or are we talking genetics? Are we talking activity? I like to run now and then, although I don't run nearly as much as I used to for a variety of reasons. But you know, I've heard all sorts of things. You know, I just turned 50, so they're saying it's the impact on your joints. Don't do it. But you know, I don't have any serious, knock on wood, difficulties with my knees. Yeah, well, that's lucky. It's good. I wouldn't say that it's inevitable. Most people will go their entire lives and not have to have any joints replaced. Okay, good. But a large percentage of people will wear out their joints before they're done with them. You know, we're living a lot longer. We're and healthier, more active lifestyles,
right? Yeah. We're doing all kinds of things. You know, more people are participating in sports and athletics, and it takes a toll on some people. You have to have a genetic disposition or a severe trauma. If you've got good genes and good joints, you may be able to do everything you want to them your entire life. But I think about 650,000 knees were replaced last year, thereabouts. With the aging population and the lengthening of life, that's projected to be over 2-3 million in the next decade or so. That's amazing. Per year. Is there a specific age or a mean average age where this happens? Or, you know, if you're involved in sports, I've heard of, you know, athletes at a very young age having issues and having It does happen. There's really sort of two different groups, right? So there's some people who are just older and they've worn their joints out. We see them at the store and they're walking slow and painful, and that's unfortunate but fixable. But that's sort of one group. It's kind of the older age group. Used to be that those were the only people that got knee replacements, and if you were young and had painful, worn-out joints, you just had to put up with it until you reached a certain age. But that's not the case anymore. People are getting knee replacements now younger and younger, and part of the reason that we can do that is because they're lasting longer and longer. Right? So you want to have a knee replacement that ideally will last you the rest of your life. It didn't used to be the case that we could redo them, but we can also redo them now, and they're modular, so you can actually take out one part and replace it if you needed to down the line. So knee replacement is becoming more and more common, and it's being chosen by people at younger and younger ages. We still try to get people into their 50s if we can. But just today, I replaced a young woman's knee. She's in her mid-40s. I actually replaced both of her knees at the same time. She's very athletic. She coaches, played all kinds of sports, and unfortunately, people in her family have needed knee replacements. And she's in her mid-40s and just had put up with them as long as she wanted to, really. And when we come back, we're going to talk about what leads up. How do you know? You know, as you say, you talk to your primary care doctor, and how do you know it's time? We're gonna ask you that. Great. And we hope to hear from viewers. If you're having some issues with those knees, folks, this is a great opportunity for you to call in. Maybe you've been through this procedure and like to share your story with us. 737+ is the number here on Medical Mondays. Take a short break, and we'll be right back.
Hi, I'm Kevin Kennedy with the Kennedy Law Firm. You know, a wise man once said that creativity will always give you the upper hand. If you've been injured, call the Kennedy Law Firm and let our creativity go to work for you today.
If you want to shed the fat and sculpt your core to get those sexy toned abs of your dreams, then stop doing sit-ups.
Say what?
and start dancing with Hip Hop Abs, the fun new ab sculpting system from Insanity creator Shaun T.
I don't want you to ever get down on the floor to do crunches again. I'm gonna break it down so you burn the fat and sculpt those abs fast.
Just do Shaun's easy-to-follow moves to work your upper abs, middle abs, lower abs, and obliques, all while you're dancing.
I went from a size 18 to a size 2. I have abs now. I've got a six-pack.
And now the complete $80 Hip Hop Abs system is 75% off. That's right, Hip Hop Abs is only $19.95. We'll even upgrade you to express shipping free. Get the complete Hip Hop Abs system for only $19.95.
Call 1-800-339-1045 or order online at gethiphopabs.com. That's 1-800-339-1045. Call now.
I'm bringing my A game.
My dish is going to be the best.
I've got the Hofstra Pride on my side.
It's our first ever Dorm Room Mania cook-off. You guys ready to get cooking? All right, hit it. 3 college cooks are going hot plate to hot plate with co-host and judge Curtis Stone.
I have to crown a winner race.
Then
I make a mean caramel popcorn.
Party on with Curtis's ultimate snacks. That's disgusting in all the right ways. Next, Rachel.
Tomorrow morning at 9 on News Channel 5. Our community is rising, and the push and pull of progress, reliable information keeps you connected, safe, alert. Trust is everything. The News Channel 5 network runs toward the future, eager to tell it all, hold the powerful accountable, and keep a watchful eye over everything you hold dear. Thank you for trusting the News Channel 5 network to be your news and information leader.
I'll be right back. Hi. You think you're probably sober?
Yeah.
But you're thinking about taking the back roads home, just in case. If you're probably sober, then why would you do that? Good choice.
Probably okay isn't okay. If you see a warning sign, stop and call a cab, a car, or a friend.
That's a full glass of wine. I'll be chatting you later.
Hi, I'm Kevin Kennedy, along with my brother Bruce Kennedy, and we're lawyers at the Kennedy Law Firm. You know, we're all the time asked, how do you get those big settlements?
Well, you know, Kevin, the last insurance adjuster I spoke to, he said the Kennedy Law Firm just keeps coming up.
Hello, come in. Y'all call us.
All right, we're back, everybody, on a Medical Monday. Dr. Thomas Rauch is here with us, Advanced Health, Southern Sports Medicine Institute. He's got a great surgery center up in Hendersonville. We're going to talk more about the location and how you can contact him a little later on. But we're talking about knee replacement, specifically the new advancements in this technology, outpatient knee replacement, which is just fascinating. We're going to talk more about the doctor with that. We want to talk to you. 737+ is the phone number. We got some callers on hold. Let's go to line 1. And oops, wrong one. Line 1 is Sandra. Hey, Sandra, you there?
I am. Thank you for taking my call.
You're welcome. Thank you for calling. How can we help?
After listening to this new procedure, that sounds amazing and fantastic and less invasive.
Yep.
My question is, will Medicare pay for it? And also, you know, if you have a supplement, that will kick in too. Or is it going to be considered experimental, and they're going to say poo-poo on it?
Well, thank you for calling, Sheila. Those are great questions. Every medical advance starts off as experimental. And this is something that has been being attempted for a number of years. Things have advanced with outpatient replacement now to the point where in certain locations, at specific centers, surgeons that are doing it using specific techniques and anesthesia and medications and whatnot, it's really not experimental anymore. In fact, one of the reasons that I wanted to wait to start talking about it was I wanted to have about 100 of them done as an outpatient first, just to make sure that it was working the way that I was hoping that it would. I did the first one a couple of years ago now, and then waited for a while before I did another, and then now it's got to the point now where we're doing it very routinely. So it's not experimental. Now, that's not the same thing as saying that everybody will pay for it. Right now, it's really only commercial insurers that are paying for it. And part of the reason is really political as much as it is anything. Medicare, the process for getting new procedures or new locations for Medicare to cover them is on a 2 or 3 year cycle.
That long.
So it just,
that long.
Yeah, there have to be public hearings and commentary and da-da-da. And so they're moving slow. But I will say that the conversation is going on, and it's something that is anticipated to be covered by Medicare within the next year or so.
Sounds great. Thank you. Appreciate it.
Sure. Sandra, thank you for calling. We appreciate it. And let's go to Jackie on line 2 now. Hi, Jackie.
Hi, how you doing?
Doing well. Thanks for calling. How can we help?
Yes, sir. I'm calling to see what material is used for the knee replacement, resurfacing, and is there any kind of rejection to the body? Because if there's anything put in there, then it would be probably, considered like a foreign object. Body.
Boy, we got good questions so
really
far.
Very,
all right,
very,
we'll
very
put
good
you on hold
questions.
here, Jackie, for a second and listen to the doc.
Yeah. So, Jackie, the materials are a combination of really two main materials. There is a metal component to it. These are made out of what we call super alloys. It's cobalt, chrome, vanadium, molybdenum. Basically, they're very, very high strength, lightweight metal alloys. But most importantly, they are not recognized by the body as anything particularly foreign. In the same way that your body's not going to reject a crown on a tooth or a filling, for example. There's also a very, very specialized plastic part to it that's made out of what's called an ultra-high molecular weight polyethylene, and now it's multiply cross-linked. It's basically all to say that it's processed in a way that makes it very, very durable. Now, the outpatient knee replacement, which really is a resurfacing procedure, is essentially the same as other knee replacements that I do for patients not as an outpatient. What's changed really that allows it to be done as an outpatient is the technique of getting it in. So using minimally invasive, muscle sparing, no tourniquet, avoiding the vessels so that there's very little bleeding associated. Long-acting medications, specific kinds of blocks in anesthesia. This whole combination of things in medications and technique is what allows that same surgery to be done in a way that allows people to go home and walk on it right away. But the expectation is still that it will last every bit as long as any other knee replacement that we do.
All right. Jackie, does that answer your question?
And I've never had anybody reject one that I've seen.
There you go.
It just doesn't seem to happen.
Yes, to answer my question, but if I can make a small comment.
Yeah, go ahead.
Take up much time. Dr. Gautsch, I have a rotary cup tear, and I was trying to pick a good doctor through workman's comp, and I did extensive research on you, your technology, the way you operate. I talked to several staffs in your office, and you're the one that I chose, the workman's comp. Even though you was in the network, you was not on the panel.
Oh, I'm so sorry that I didn't get to see you.
I did opt out, and I will be coming to see you on my own because I was just totally impressed, and especially with your demeanor, because I did have some experiences that I wasn't quite happy with some of the doctors. So I'm really glad. I don't think it's no coincidence that I happen to sit down here and turn on the TV, and there you are.
Well, you're very kind. Thank you, and I'll look forward to seeing you.
Okay, now. Bye-bye.
Thank you. That brings up a really good question I was going to ask you, just about, patients coming to you. She mentioned your demeanor, and I know that you mentioned so many other people. It's a team effort,
it is a team
that you
effort.
Work with. There are
Absolutely.
nurses and rehabilitative nurses, anesthesiologists is important, and so on. And every step of the way, you have someone coming in, and it's a nerve-wracking experience to have something like this done. This kind
Absolutely.
of
I've been a patient. I've been a patient before, and I didn't particularly like it. Honestly, I don't like being on that side of it, but I remember it. And and I've sat in waiting rooms, and I've been in an operating room on the receiving end, and so it's very, very important to me that people gain a comfort level and really a trust level. I mean, that's the most important thing. If you can't trust your surgeon, you should not have them do your surgery.
Yeah, and you like callers like that or patients like that who come in already armed with some information. It may not always be the most accurate, but at least they've started to do their homework, and they can bring you the information, and you can easily, tell them, yes, this is correct information, this is not, and here's why.
Well, I love taking care of patients like that because a person who's invested in getting better has a much higher probability of getting better. I can do absolutely everything perfect. And if a patient's not invested in getting better, that limits how good they're going to do.
Sure. Good point. All right, a lot of calls coming in. We really appreciate it. Let's go to Jeffrey on line 4. I keep hitting the wrong button. Sorry about that. Old habits are hard to break. Hey, Jeffrey, how are you?
Hello, can you hear me all right?
Yes, we can hear you great. What's on your mind?
Well, I have been honestly putting off this. I've been kind of dreading the scenario here.
Yeah.
Replacing my knee, and I was kind of wondering about how much work I'd have to miss and this and that. I had a hip replacement a couple of years ago, my left one, and I went through a time with that. That son of a bitch put me down. I wasn't able to work for 3 months.
Really?
Oh my goodness. Yeah, that's pretty tough. So, good questions. There's two ways that people will kind of go through knee replacement. The traditional course is a hospital stay, typically of 3 or 4 days, and then therapy, maybe in an outpatient setting, or maybe sometimes in a skilled facility or rehab facility, which you may have had a couple years ago when you had your hip replaced. And that's typically a 3-month or so process. What we've developed now is really a fast track for people who are good candidates for it, which basically means that their health is otherwise pretty good, they're highly motivated, still in pretty good shape, and not afraid to do the rehab that they need to. In that instance, people can come to our center, have a knee replacement, and basically stay at the center for about 4 hours, and then go home, walking on it. Usually walking with a walker for 3 or 4 days, and that's it. Then maybe walking slow, you know, and reaching out to touch something as they go for the first week or two. Therapy typically goes on for about 5 or 6 weeks, and we're done. Most of the time, by the time we get somewhere in the 3rd or 4th week, people are doing better than they were before the surgery, both functionally and comfort-wise.
They can really feel the
driving
difference.
At that point, yeah. So it's typically about half the length of recovery. Now, I wish I could tell you that you can have that surgery today and go skiing tomorrow. It's not true. We're not there yet. Yeah. But it's substantially
the fact,
better.
Doctor, you said how soon after surgery? I would be so frightened as a patient to stand up and put any body weight, you know.
Well, we wouldn't have you do it on your own, right? So we've got therapists that are there helping you get up.
How soon after the surgery? You said a matter of hours.
Yep,
now,
hours.
To where you want them to get up and start, you know, using the walker to help you, obviously, but.
Right. So 2 major obstacles that prevented it in the past were that the kinds of anesthesia that we did would typically make the leg rubbery for a day or 2 and unusable. And the other thing is that pain was previously a major obstacle that you had to get over before you could even get up and start moving around.
Right.
And now with specific anesthetic techniques, we use ultrasound guidance to get right to the exact nerves that give you feeling it around the knee. Use very long-acting anesthetics, local anesthetics, that don't inhibit the function of the muscles, so that you can comfortably, literally get up, put your full weight on this knee replacement.
So that part of it, the anesthetic advancements, that's huge.
That's
obviously
huge part.
One of those obstacles that you talked about in your job. What is there any kind of sedation during the procedure?
Yes.
Because personally, I wouldn't want to hear anything.
No, nobody does. Nobody. You just don't want to hear the tools.
Exactly.
You know, and the things that are going on.
There's some serious work going on.
So when we do that kind of block of the nerves, then we don't have to do as deep of an anesthetic. Right. So you'll be unaware of what's going on,
just
but not
mild,
but
to where
we
you
don't
can
have
come
to use
out
a
of it
deep
quicker.
anesthetic. Right. We don't have to use a deep anesthetic to prevent the pain and the feeling. Now, there's other things that go along with it too. So one of
and that, in turn, I should say, is safer for the patient.
It is. That's
not using the deeper anesthetic.
It is safer. So I do the surgery without using a tourniquet. So it used to be that you would march through the tissues, cut through the muscle and everything else, and then identify the bleeding when you were coming back out again and try and coagulate them as they go. Instead, I sneak around the vessels, so no major vessels are cut in the surgery the way that I do it. I also don't cut through any of the muscles or the ligaments. It's a sneaky way to get in, and that allows those tissues to stay still functional and usable and comfortable right after the surgery.
So with this new advancements, these new procedures, has anything surprised you? Do you still get surprised sometimes going into or with the advancements, with your ultrasound, with everything ahead of time, when you go in, you pretty much are like, yep, this is just what I expected.
Well, I am so I'm double-minded about it. As I said, I've done about 100 of them now outpatient.
Yeah.
It still does surprise me just a little bit to see people up walking around that soon after surgery, because I've been doing it for about 20 years now, you know. And so in the old days, you used to stay in the hospital for a week, and we didn't get people up for the first couple of days. So I know that it works. We've done it a bunch of times. Everybody at the center has the opportunity to stay overnight if they need to or want to. So far, in the first 100, nobody has. Everybody has gotten up and walked out.
That's remarkable.
And that still surprises me a little bit.
All right. A lot of calls on hold. We appreciate your patience. We're going to get to you. We've got to take another quick break here on Medical Mondays. We'll be back with your calls right after this.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
After a sunny start for most, it's been a cold, gray, damp day across Middle Tennessee and Kentucky. A cold rain has started to fall across most of the area. We'll continue to see scattered cold rain showers prior to midnight. Once we head past midnight, temperatures will drop even further, and that's when we expect this cold rain to mix with some light, wet snowflakes. Actually, not looking at any wintry accumulations, but flurry activity will likely be ongoing during that Tuesday morning commute. Here's a look at temperatures across the southeast. You see that cold invasion surging towards the southeast. Current conditions here in Nashville. Overnight tonight, we drop down to 34 in Nashville. It'll be a little colder outside the city, hence the transition to some wintry weather. Again, not expecting accumulations from this, but some flurries flying. That may add some challenges to that Tuesday morning commute. Top temperatures Tuesday 42 with a stiff northwest wind between 15 and 20. We'll keep it brisk.
Idle hands. They say they're the devil's workshop. Easy targets. Quick to kill time. But give idle hands something to do, a place to go, a purpose. And they're capable of amazing things.
All right, we're back, everybody. We're taking calls during the break here. Also helping some folks out because we got all of our lines are packed right now as people call in to talk with Dr. Thomas Gautsch. Sorry, did I say Rouch earlier? Gautsch. Gautsch. Got it. Dr. Thomas Gautsch, who is a specialist when it comes to outpatient knee replacement surgery. And it's fascinating technology, folks, as we talk with him and we talk with you. Let's go to John on line 5. Hey, John, welcome.
Hi, can you hear me okay?
Yeah, we got you great. Go ahead.
All right, well, the doctor has presented me with a new problem here.
Uh-oh.
Originally called to ask, I know I need a knee replacement, a complete replacement.
Okay.
I talked to one doctor, and he owns a patent on the knee that they're putting in, and that bothers me tremendously. And then I looked at other knees and said, well, how do I know what's the best knee?
Okay.
Listening to you tonight, and there, I accepted that I was going to have 6 to 8 weeks to get this thing back in shape. And now the doctor's telling me here that might not be the case. So is there...
Good question. So
surgery that doesn't work versus traditional?
Very, very good questions, and other people have asked as well of me when they come to see me. The knee replacements these days, so in 2017, most knee replacements are all being made out of largely the same materials, and most of them are going to have about the same expected life expectancy or wear rate. So the design differences are really more to tailor the knee replacement to the patient because we're all put together differently. And so there are certain replacements that we'll choose sometimes that'll be better for a specific patient, their anatomy, their lifestyle, things like that. But most all of them are made out of the same materials, and we would expect them to last these days at least about 20 years, maybe longer. So partly depends on your age and really how long you would need to have the knee.
Does that make sense, John?
Yes, it does.
John, how many opinions have you gotten on your knee? Have you gotten a second or third opinion?
No, just one.
Yep.
How old are you? Can I ask, John?
77.
Yeah. So, John, you're right in kind of the sweet spot age for having knee replacement, provided that your health is still good. At this point, you may or may not be able to have it as an outpatient, or it may not be right for you to have it as an outpatient, but the same techniques that I use to be able to do that surgery and let people go home the same day,
they still apply.
Or the techniques that I use to do knee replacements for people whose health maybe needs to be watched a little bit more closely, and we would keep somebody like John overnight probably.
Yeah.
Not necessarily, but probably overnight. But you'd still be able to be up and on it, walking the same day or the next day. And that's just the techniques and the technology that we have now.
John, thank you for the call.
All right, thank you.
Appreciate it. All right, let's go to Bill next. Hey, Bill, welcome.
Hey, Eddie, I'm a 76-year-old man, and I do quite a bit of walking out on the farm, and I've got a popping in my knee. Just every once in a while, it pops when I walk.
Sure.
I also want to ask one more question. I have Medicare and TRICARE. Will that cover if I need something done to my knee?
Medicare and TRICARE will cover most everything that you would need to have done. Now, an earlier caller had asked whether they could have outpatient knee replacement surgery with Medicare, and Medicare hasn't quite caught up to us yet. So, you know, Medicare moves a little bit slower in terms of what they are willing to let people have.
But you expect that?
But I expect that, right? So
at some point,
it should hopefully in the next year or two it'll come around and Medicare will be covering it. And with the new administration, it may be faster. Well, I don't know. They're thinking about things differently. But popping in your knee, popping in particular in joints, is not worrisome. If it's painful popping, that's a different sort of a thing. Or if it's pain without popping, that's a sort of a worse thing. If your knee is just making noise, so do mine. So do most everybody's. Yep. And I wouldn't get too worked up about that.
Yeah. Is there any pain with it, Bill?
No, sir, not any pain. Just pops when as I walk.
And you sound like a pretty active guy for 76.
Yeah.
Yes, sir.
Well, and you're a farmer, so we know that you've used your knees a lot. But if you're not having very much pain with it, quite honestly, I wouldn't do anything about it just yet.
Okay, I appreciate it.
All right, Bill, thank you for calling. We appreciate it. 737+ is the phone number to call, and we got a lot of people calling in right now. Let's go next. I believe Diane is on line 2. Hi, Diane. Welcome.
Hi.
How are you tonight?
Oh, just fine.
How can we help?
I wanted to ask a question. I saw part of a documentary about on 3D knees, where they take a 3D X-ray of the knee.
Yes.
And then they make a knee to exact your knee.
Yes, that's right. There are several companies that do that. Those custom knee replacements are one way of getting surfaces that are matched specifically to you.
Is she talking about a 3D printer kind of thing here, or more of a 3D mapping? And
well,
then
it's not a 3D printed thing, but it is a CAD CAM sort of a knee.
Okay,
that's right. So there's technical reasons why, although I recognize some benefits to them, I've not jumped onto that yet. It's actually a much simpler surgery and usually a little bit faster surgery to do too, because you don't really have to do as much technically in the operating room. The problem is it doesn't take into account your ligaments. And the balance of a knee really is in the soft tissues of the knee. The surface part is easy, getting the surfaces right, but getting the ligaments balanced exactly right. That's the thing. You know, you could get a custom tire for your car, let's say, a tire that's made specifically for your car, all the right dimensions and everything. But if it's not put on in the right alignment or the right balance, well, it's just not going to help you that much. It's not going to last for very long. And so this is one of the things that when you're laying flat getting a CT or an MRI scan, they're not really taking into account even if your ligaments are completely incompetent or torn or whatever. So in the operating room, instead, what I do is customize the knee replacement to the patient right then using modular components. But the differences in the different sizes is just variables of just a couple of millimeters. And we use a virtual reality workstation, 3D cameras in the operating room. It's digital operating rooms. And I basically do the knee replacement on a VR workstation and then translate that to the patient based on specific data points that are taken from your knee. And
how long does the procedure typically take you from beginning to end?
It's depends. It depends a little bit. So some people have got a lot of deformity and you have to do a fair amount of work to get them ready for the replacement.
Right.
But typically the surgery is about an hour, hour and a half,
That's
something like that. The navigation adds a little bit of additional time, the data collection and then the computing time and stuff. But still, most people are in and out of my time in the operating room is about an hour and a half. And there's production time on both ends, and then people, as I said, will stay for a couple of hours afterwards.
All right, Diane, does that answer your question?
Yes, thank you very much.
Oh, thank you for calling. We appreciate it. Let's go to Adam next. Hi, Adam. Welcome.
Hi.
Hey, what's on your mind?
I'm fixing to turn 40.
Okay.
And over the last year, my right knee has been giving me a fit. Popping as I walk constantly. It's popping and feels like crunching in my right knee.
Yep.
but over the last couple of weeks, it's progressed worse with a lot more pain. The other day, I was walking into a room that I was working in, and I was just standing there, and it popped so loud, it scared my worker half to death, and it just about put me on the ground.
Oof.
I don't know if I've torn a meniscus or what, and it's just scaring me.
Yeah.
I'll push on the sides, and I can't even stand it.
Well, Adam, I'll tell you, have you seen anybody about it yet, would be my first question.
Not yet. I work so much, it's hard for me to get off of work and go to the doctor these days.
Sure. So odds are good if I'm just betting on your age and your description of symptoms. Obviously, you need to be examined. We need to do x-rays and possibly an MRI scan. But odds are good that you've not got to the point yet where we would need to do something big like a knee replacement. Even an outpatient replacement would probably be more than you would need at this point.
Right.
There are lots of things, we haven't really talked about it, but there are lots of things that we can do for knees to preserve them and keep your God-given knee going until it has got to the point where it's worn out and nothing else is working. So it doesn't sound like you've really needed to explore any of the other options that would come before replacement yet, and there may be some very good ones that could possibly even solve your problem without having to do anything very big, or just very minimally invasive, an outpatient scope procedure, something like that, for example, if you even needed something like that. Medications or injections might be all that you need.
All right, Adam, does that answer your question?
Yes, sir.
Sounds like, you know what? You're going to have to work some time in and go see someone. Just find the time. I know you're one of those workaholics.
Yes, sir. Yes, sir.
Good luck with it. Thank you for calling.
Very much.
All right.
Good talking to you.
Let's go to Arlene next on line 3. Arlene, welcome.
Hi, how are you?
Hi, Arlene.
Doing
Good,
great. Thank you.
Well, I'm actually calling for my mother-in-law.
Okay.
About 4 years ago, she had a knee replacement on her left knee. And now it's looking like she's going to have another knee replacement. She's a diabetic, though. So I was trying to find out if there's something else that she can do, or even if this outpatient would work for her so she can have less recovery time. Because it took her the whole 3, 4, up to like 5 months before she was able to truthfully recover.
Yeah.
So I didn't know if there were any other options. Is outpatient something we should look at? I know I've heard of different procedures, but I was trying to see what your take was on it.
Right.
Thank you for the question. It's difficult, obviously, to say without seeing her, going over her records or examining her. But I will say diabetes has become very, very common. And so we've learned how to work in a diabetic setting, in a sense.
Right.
Now, at the same time, it does increase the risks of things, and it does slow healing down commonly. So it can make it a longer process just because of the diabetes and whatever else she might have going on along with it. That isn't to say that she wouldn't be a candidate for these things. But really, we would need to sort of dig a little deeper and get a little more information, examine her. There are some things that can be done, but as you know, with diabetes, there's some things that we can't do. So any kind of steroid medication would probably not be able to be done for her, because that can complicate her diabetes.
Right.
But there are other things that we can do. There are gel injections and synthetic joint fluid, and sometimes a scope procedure can clean up a joint and get some good pain relief from that. So.
Okay. So she can still look into the outpatient.
Potentially, that's right. It's for outpatient knee replacement is really for a select group of people. Typically, it's going to be for people who are in their mid to late 50s, early 60s, still fairly active, people who are health oriented is the best, somebody who's keeping themselves in pretty good shape, physically fit, but where the pain of the knee being worn out has gotten to the point that it's no longer allowing them to do those kinds of things. That's really the ideal candidate for outpatient.
But still worth a visit to have a consult and talk. Yeah,
absolutely. Because there are other options, and even a traditional, replacement might be good for her again.
Okay. Well, thank you so much.
You bet.
Thanks Arlene.
Calling.
We appreciate it. 737+. If you can get through, because we've got a lot of lines here. Before we go to our next break, I want to ask you about the consult.
Yes.
So if someone calls or they get referred by their doctor to go see you, do they get a chance to see you during the consult, or does it depend on their issue? They may be seeing other members of your team.
No, I like to see all of my patients first, and the decision making and the conversation really needs to be patient to doctor, in my view. Now, typically, I see people after they've already tried a variety of things.
Right.
Their regular primary care doctor is usually the one who will try different medications and ultimately get the x-rays or whatever other studies they need that determines that, okay, you know, I can't do anything for you anymore. You need a knee replacement. I'm sending you to Tom.
Yeah.
And at that point, then I really do like to go over all the information and have the discussion.
Yeah.
And talk about what's going to be the very best course of action, and then, you know.
How soon after that are you able to schedule surgery? How far out are you looking? Because, you know, you guys get busy.
I was hoping you would not ask me that, because that's one of those things that
it's as fast as you can.
Yeah.
As fast as you can, given that
my schedule tends to run. I try very hard to keep it down
we'll just
to
leave it at that.
6 or 8 weeks.
No, that's not bad. That's not bad. 6 or 8. I mean, I was thinking it could be 6 months down the line.
Well, I only do a very narrow scope of things, really. I just do shoulder knee surgery so that it's doesn't take forever.
And it's the Indian Lake Surgery Center in Hendersonville is a part of all this, right?
That's right. So the problem with doing outpatient knee replacement in Tennessee for a long time was that there really wasn't any place that was set up to do it.
Right.
So we've recreated basically hospital size level, even better operating rooms in an outpatient surgery center setting that's got patient rooms, and it's set up specifically so that we can do this and let people go home.
Excellent. All right, we're going to talk more with the doc. We've got a few lines open if you'd like to call in. 737+ here on Medical Monday. Stay with us. We're going to be right back.
This week on Fishin' Affliction TV.
Get the map of Okeechobee? Okeechobee's a big body of water, isn't it?
Join Team Fishin' Affliction for part 1 of their very first trip together on legendary Lake Okeechobee as they're fishing the Big O.
So basically what you're getting at is you're lost. I'm not lost.
Your Fishin' Affliction TV weekend begins Saturdays right here on News Channel 5+, your home for
Fishin' Affliction time for those who've got it bad.
Welcome back, folks. Our newest item today is a brand new Kia Forte. You can pick up yours today for no money down and just $199 per month. It includes your tax, tag transfer, title, and all the fees. And it's not a lease, you own it. Plus, you'll get Kia's 10-year, 100,000-mile warranty. And it looks like we have a caller on line 1.
Oh, I just love the Kia Forte. And I love coming into Franklin Kia. And that Dan is such a handsome boy.
Mom?
Hi, honey.
Gotta go, Ma. Franklin Kia, keeping it awesome.
Tennessee, one of the most innovative and modern states for healthcare in the nation. At United Health Group, we're honored to provide high-quality care to more than 1 million Tennesseans and to equip doctors and nurses with data and insights that can help prevent and treat illness. More than 3,000 of us live here, serving our communities every day. Tennessee doesn't shy away from tough healthcare challenges, and neither do we. United Health Group, built for better health.
Oh, beautiful for spacious skies, for amber waves of grain, for purple mountain majesty, above the fruits and
Back taking your calls here tonight on Medical Mondays. We appreciate your patience, folks. Let's get to line 5. That's Vicki, who has called in to talk with Dr. Gautsch. Go ahead, Vicki.
Hi.
I'm calling concerning one of my left knee.
Okay.
I've had the meniscus repaired.
Yes.
I've gone through the cortisone shots.
Yep.
I had the Suparts injections, and now I've been told that the only thing that's going to save this knee is surgery.
Oh,
Have
boy.
it replaced. So my question is, since this is a new procedure, does insurance like Blue Cross Blue Shield federal employees pay to have this type of replacement done?
I'll tell you, most do. First of all, it's you've just listed the common things that people will go through to try and prevent the need to have replacement. And it sounds, unfortunately, like you've been through them and that they're not working for you anymore. But it's good that you tried those things. And in fact, you probably are getting to the point where you need to consider replacement to get back the comfort and function that you want. Specific to insurance, you know, there's 1,000 different insurances out there these days. Most will cover it. Most actually are happy to cover it because it's a lower cost procedure than having it in the hospital. And so, but I'll tell you, the very best way to find out is to call your carrier. On the back of your card is a number, customer service number, and ask them if they'll cover it. And if they're not sure, then tell them that you want to be sure that they will. If they don't right now, that you want them to, because you want to have it that way. And you know, and just push on them a little bit to get you the answer that you want. And it's new enough that not all the insurance companies have gotten on board with it yet. Some of them are just not even really that aware of it, and some big companies, the wheels turn slowly. But my experience at the center so far has been that most all commercial insurance carriers will allow patients to have this procedure and are very happy to have that done.
Yeah. All right, Vicki.
Okay.
Thank you for calling. Good luck.
Thank you.
Hope everything turns out okay for you.
Thank you.
All right, bye-bye.
Bye-bye.
She really listed the progression there, too.
She did.
And you brought up a good point, Doc, that you know, it kind of makes sense to have this done because you think about all the problems that she had and the medical costs that she's incurring.
Right.
One step after another, and still not getting where she needs to be healthy again.
Right.
To where now she's able to be more active and healthier.
Yeah, but thank goodness we do have we have an ultimate solution for virtually all knee problems now.
That's fantastic. All right, let's go to Paul on line 2. Hey, Paul.
Hi, good evening. How are you?
Doing well, thank you.
Thanks for having me on.
Sure.
I went through all the steps to, like you say, to try to rehabilitate the knee without going through the surgery part of it. And then I guess it was time at 50, let's see, I had them done 5 years ago now, so I was like, 5 years ago, and I had Dr. Petty replace my knees.
Okay,
very good.
And did a nice job.
Yeah.
But still, they're not like the ones that God gives you. They're limited to a lot. That's what I want to ask you is, how durable are these knees and the materials that they use to put them together?
Sure.
Can I go out and race my ice bike again and flat track and
do all that stuff, huh?
Yeah.
Right.
I'm just asking because I really don't know how much you can push them. You know.
Sure.
I mean, I don't want to go out and tear them up and then end up finding out that I've got to go in and have them redone again.
All right, hold on.
It's not nearly as much fun the second time around, people tell me. So. First of all, I know Dr. Petty. He's a very good doctor, and I'm sure he did a good job for you. So I'm glad to know that you've been able to do most of the things that you want to with them. The materials are really, really good. I haven't seen anybody wear one out yet, and I've been putting them in for 20 years now, right? So what has changed mostly is that the materials have gotten even better over time. But the way that I'm doing the surgery now is more technique that allows us to do it, and certain medications and things like that. It's a combination of things that allows us to do them as outpatients. I'll tell you, what I tell my patients is that I've been putting knees in now, and I've done thousands, literally thousands of knee replacements over the course of 20 years, and nobody has worn one out yet. There have been a couple little infections. It happens sometimes, but beyond that, they're all out still kind of trucking around. Now, it's not the material that is the problem. Really, when they fail, if they do, it almost always is where they attach to the bone. So knee replacements kind of don't wear out so much as they come loose, in the same way that dentures wouldn't fit after 20 years, because bone is living tissue and it's constantly kind of slowly changing its shape, and the replacement can kind of come loose from the bone. So for that reason, we don't ordinarily recommend that people do any kind of pounding type activity, because we know that puts a lot of stress at that interface where the replacement attaches to you, and it's that interface that we want to protect. So
running?
I'm not sure. Running, I have patients who do it, and when I see them I honk at them, because I've told my patients not to run on them, because I don't want them to wear them out either,
right?
Or to jar them loose, but I know some people do it.
So just switch to biking.
Yeah, biking would be great. Yeah. So I don't know what ice bike.
Yeah,
what you said, I'm not sure what's involved with that.
Yeah, what is that?
It's not like motocross. You're on a flat surface, and basically you're just going around
the track.
Well, that should be fine as long as you're not planting your leg real hard to do it.
Yeah, that's
so. Look, people with knee replacements can play. Right. You can play doubles tennis. You can walk unlimited. You can hike. You can climb. People horseback ride. You can garden. We just try to stay away from the pounding.
Yeah, right.
The jarring of running on knees can make them wear out faster.
All right, Paul, we've got to wrap it up because I want to get one more call in before our break, but we do appreciate it, and we want to go to Mark next on 4. Hey, Mark.
Hey, how you doing?
Doing well, sir. Go ahead.
I just got a question for the doc.
Yes.
I was a paratrooper in the military, and I just want to know, sometimes my knee swells up and sometimes it pops. Do you think by me being a paratrooper in the military could have some damage to my knees?
You know, it's possible. I've actually seen and taken care of a number of paratroopers, and it's not the jumping out that gets you in the knee, it's the landing. Yeah, it's the hard landing, which is unavoidable sometimes. So that kind of pounding in a knee can do some damage that catches up with you sometimes down the line. Now, you know, how bad it is or how far along it is, that would be a discussion that we would have to have. We'd have to do some x-rays. We'd need to examine your knee. Have to find out a little bit more of the details. But if it's bothering you a lot, you should have somebody look at it, because there's lots of things that we can do.
Mark, how many jumps and hard landings are we talking here?
What I did 6 years in the military, got out with an honorable discharge. I said a little over 300 jumps.
Wow, that's a lot.
Yeah,
that's more than just your recreational parachute.
Yeah,
well, good luck with it, and thank you for your service.
Hey, thank you.
We appreciate it. All right, let's take one more call. Who was on line 6 again, Courtney? Jane. Okay. Hi, Jane. You there?
Yes, hi.
Hi, go ahead. We got about 2 minutes. Go ahead.
About 15 years ago, I did something really stupid. I was out at my dad's farm, and I was picking up chestnuts on a sloped hill. And instead of just walking around and picking them up, there were so many, I stooped down, like with my knees bent, and I overreached and went over. And I'm in great shape, other than my knee now, by the way.
Okay.
But I heard something tear, and I just barely made it to my dad's house. And I ended up going to Dr. Robert Stein at Tennessee Orthopedic.
Yep.
And he said I had torn the right meniscus out of my right knee, and he couldn't repair it, and he removed it. That was about 15 years ago. Since then, my right knee dislocates.
Oh boy.
If I'm not really careful, like I'll be sitting, say, in a restaurant or in a chair, and move my knee, and all of a sudden pain shoots everywhere, and it's dislocated. What can I do about that?
Yeah,
I'll tell you what, Jane, we have to hit a break here in like 15 seconds, so I don't want to cut off the doctor. We're going to go to the break, but we're going to answer your question in the break, all right? Well, stay on the line. Stay on the line with us, all right? Hang on. We'll get right back to you. We're going to take a quick break, everybody, and wrap things up after this break here on Medical Mondays. Thanks.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
After a sunny start for most, it's been a cold, gray, damp day across Middle Tennessee and Kentucky. A cold rain has started to fall across most of the area. We'll continue to see scattered cold rain showers prior to midnight. Once we head past midnight, temperatures will drop even further, and that's when we expect this cold rain to mix with some light, wet snowflakes. Actually, not looking at any wintry accumulations, but flurry activity will likely be ongoing during that Tuesday morning commute. Here's a look at temperatures across the southeast. You see that cold invasion surging towards the southeast. Current conditions here in Nashville. Overnight tonight, we drop down to 34 in Nashville. It'll be a little colder outside the city, hence the transition to some wintry weather. Again, not expecting accumulations from this, but some flurries flying. That may add some challenges to that Tuesday morning commute. Top temperatures Tuesday 42 with a stiff northwest wind between 15 and 20. We'll keep it brisk.
It's our Factory Direct Pool and Spa Sale at Family Leisure.
Buy now and save big on swimming pools. Round pools in several heights and sizes starting at $7.99. Oval pools in several heights and sizes starting at $19.99. Spas, spas, spas. Now is the time to buy. By-person spas from $29.99. Swim spas now only $99.99. Layaway and special financing available. Become the family hero and save money.
Factory Direct Pool and Spa Sale going on now at Family Leisure.
He was acquitted of killing his wife.
Not guilty of the crime of first-degree murder.
Now he's getting married again. Next Inside Edition, actor Robert Blake. He starred as Beretta on TV. Now he's getting remarried. Wait till you hear who the bride-to-be is. Then, is Pamela Anderson really in love with the guy many call the most dangerous man in the world? Watch the next Inside Edition.
Tomorrow at 4:30 on News Channel 5.
All right. Hey, we want to thank all of the phone calls. Unfortunately, we couldn't get to everybody, but we really appreciate you calling in. And they were terrific questions, weren't they, Doc? See, they made it easy for the Doc's first visit here to Medical Mondays. But we really appreciate Dr. Thomas Gautsch spending an hour with us and answering your phone calls. Want to give out some information. This is sponsored, of course, by advancedhealth.com. There is, you can email appointment request to Medical Mondays at ouradvancedhealth.com. There's the referral line for you as well. Dr. Gautsch works at the Southern Sports Medicine Institute, and there was a lot of information here that I didn't get to. But you can go to their website, which is southern-sports.com. You can also go to advancedhealthmedicalmondays.com. Lots of information. Doctor, thank you for being here. We appreciate it. Thank you so much. Fascinating stuff. We hope to have you back sometime. Thank you, everybody, for tuning in. Stick around for Sportsline. So long.